Vitamins for the heart and blood vessels. To improve the condition of blood vessels and the heart, you need to normalize your lifestyle, adjust your diet, and physical activity. Vitamins for the heart and blood vessels also give good results. Today we will talk about them in more detail, what they are, how they are useful, who should take them and why. Our heart and blood vessels suffer daily from stress, poor environment, poor nutrition, and bad habits. Special vitamins will help support them, but how to choose them? It is important to understand that vitamins for the heart and blood vessels will not save you from serious diseases and hereditary predisposition, but they will compensate for the deficiency of substances necessary for the normal functioning of the cardiovascular system. What vitamins will be useful? If high cholesterol is diagnosed, it will be useful to drink complexes with nicotinic acid, vitamin E, omega-3. For hypertension, doctors prescribe diuretics that remove magnesium and potassium from the body. To restore balance and support the heart muscle, it is recommended to take these minerals separately, in courses or on an ongoing basis. Essential vitamins for the heart and blood vessels. E. Reduces cholesterol in the blood, dilates blood vessels. C. Accelerates the elimination of bad cholesterol. B6. Regulates the functioning of the heart muscle. F. Contains essential fatty acids that prevent platelets from sticking together and thin the blood. PP. Strengthens blood vessels. B1. Is necessary for the normal functioning of the heart muscle, against the background of deficiencies, tachycardia and hypotension develop. B13. Improves myocardial contractions. B3. Dilates blood vessels, activates blood circulation, lowers blood pressure. Q10 is a coenzyme or vitamin-like substance, the main source of energy for the heart muscle. N. Provides effective prevention of thrombophlebitis, varicose veins, helps in the removal of bad cholesterol. Who should take cardiac medications? Vitamins that strengthen the heart will be useful for people of any age. Taking them is a prerequisite for maintaining health and prolonging life. Ideally, a doctor should select a complex, especially if problems have already made themselves felt. There are fewer requirements for prophylactic agents, but they must also have sufficient effectiveness. When taken over a long period of time, vitamins show good results. They strengthen the muscles of the heart, improve the condition of blood vessels, and are an effective measure for the prevention of many diseases. The use of the corresponding complexes is shown. Athletes and people of physical labor. Patients with a history of serious cardiac pathologies. People who have problems with the blood vessels of the head, the functioning of the lower extremities. For everyone over 35 years of age for preventive purposes. Workers in hazardous industries. For adolescents according to individual indications and after consultation with a doctor. Today you can find natural preparations and advanced chemical pharmaceutical developments on sale. There is no universal formula for everyone, you need to take into account the indications. Vitamins can be bought without a prescription, the main thing is to follow the instructions and not exceed the dosage. This will not increase effectiveness, but will increase the likelihood of adverse reactions. The best vitamins to strengthen blood vessels and support the heart. If we talk about the best vitamins for maintaining the heart and cardiac muscle, then we need to mention L-carnitine, converts excess fat into energy for the heart, reduces dangerous cholesterol and gently stabilizes blood pressure. Coenzyme Q10 is directly involved in the formation of molecules that are responsible for energy transport. If there are few of them, contractions of the heart muscle are disrupted. A healthy young body produces the substance in excess, but then its amount decreases. The natural result is disruptions in the functioning of the heart, hardening of blood vessels, and aging of the myocardium. In old age, it is necessary to take Q10. Lecithin is responsible for transporting nutrients to the heart. Prevents the active formation of cholesterol plaques, restores normal fat content in the blood. Lecithin is needed by patients with hypertension, coronary artery disease, cardiomyopathy, during rehabilitation after a heart attack, stroke. In addition to vitamins, you need to take a number of microelements. This will provide comprehensive support to the body, improve the condition of blood vessels and the heart. Microelements for the heart. Cardiovitamins usually contain potassium, a microelement that takes part in conducting electrical impulses along the nerve fibers of the myocardium and normalizes the sodium content in the body. Magnesium is recommended. It lowers blood pressure, expands the vascular lumen, evens out working rhythms, and is involved in the synthesis of enzymes that are responsible for the normal functioning of the heart. Selenium is also useful. It helps to better absorb essential nutrients and neutralizes the effects of free radicals. A lack of selenium increases the likelihood of ischemic heart disease, stroke, and heart attack. Phosphorus is good for the heart because it improves the transmission of nerve impulses and muscle contractions. An important building element of cell membranes. Calcium strengthens blood vessels and improves myocardial contractility. Minerals with vitamins are produced in the form of tablets, capsules, powders, and injection solutions. Preparations may contain a single element or a whole complex. The selection should be made by a doctor, taking into account the individual characteristics of the patient's body. You also need to monitor the reaction after you start taking it. If something worries you, perhaps the drug is simply not suitable for you. Before starting treatment, make sure there are no individual intolerance reactions. Although nutrients are sold without a prescription, they are not neutral or harmless products. They have contraindications and side effects. Self-medication is not the best option at any age. You are wasting time and may choose a drug that simply won't help. It would be more correct to contact a specialist for an appointment. Recommendations for taking vitamins. Cardiovitamins can have different compositions. Choose the optimal formula taking into account the diagnosed deficiencies. What is better, a complex drug or individual vitamins for the heart? It all depends on individual indications and dosages. If the body has an increased need for specific substances, they should be taken separately. We decided to take a course for prevention, support of the heart and blood vessels. You can stop at complex cardiovitamins, which contain everything you need. Why you shouldn't self-medicate. Vitamin preparations and mineral complexes may be incompatible with a number of medications. The doctor will clarify what you are taking and, taking into account the information received, will recommend the best option. It may be necessary to space out the intake of vitamins and medications over time so that the drugs do not interfere with each other's actions. If you take vitamin supplements, make sure they are compatible with each other. This will help you stay healthy, achieve optimal results, and save money. A proper diet has a positive effect on the condition of the heart and blood vessels. In this case, it is worth taking a closer look at the Mediterranean with a high content of greens, vegetables, olive oil, fruits, and seafood. Broccoli, dried apricots, nuts, cold water fish, pomegranates, apples, bananas, tomatoes, pumpkin, dark chocolate are good for the heart. If your doctor prescribed cardiovitamins, be sure to take them for a while. But adjusting your diet will also be useful.